Here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So baby gates, I know babies are not typically your area of expertise, but what do you think about them?
I think there's always need to be cautionary about anything you purchase for your child in terms of protecting them from danger. It's man-made, and kids figure out ways to get around a lot of those types of obstacles. So it's a good cautionary tale in terms of that. But kids are kids, and they're going to injure themselves as they have.
They climb out of cribs.
I know, for many of years, so we can't necessarily put them in a bubble and protect them forever. Unfortunately, they have to grow up and they have to get out there and get beat up and scraped and those sorts of things. But do your best. But it's not a perfect world out there. It never will be. That's not living. You know, we have to accept some of those risks of living. But certainly, those are some good suggestions that the segment had.
We got hurt along the way, and we still made it. Some of us.
I didn't go to the hospital much when I was growing up.
On to some of our viewers' medical questions. This person asked, I have poison ivy on my forehead, 53-year-old female. What's the best thing for it?
We typically do steroids, either tablets or topical steroids. You can probably try something over-the-counter, hydrocortisone, or you can get a prescription for that. That's normally very easily treated.
Anything over-the-counter?
Probably the hydrocortisone cream works very well. Benadryl, maybe. A lot of times if it's a big area on the forehead, a lot of people don't like to have those sorts of things on their forehead. They need prescription strength topical agents or tablets.
Okay. This person says they're in their 70s. I had rotator cuff surgery. Can this affect the nerve to your thumb and pointing finger?
Typically not. Two kind of different anatomical positions. Certainly if the surgery went well, you could have two problems. A pinched nerve in your neck can cause that, or a pinched nerve in your elbow can cause that. Rotator cuff injuries normally are caused from degenerative joint disease or arthritis. So a lot of times you might have disease in other parts of your body that's causing those symptoms. Typically it should not come from the rotator cuff surgery itself.
Okay. After having a CAT scan performed recently, it was discovered I had gallstones. My doctor feels I should have my gallbladder removed just as a precaution. I haven't had any symptoms or pains associated with the gallbladder. What's your opinion of this elective surgery?
I think if this was my patient, typically we base it on symptoms. That is my thinking. That is what I was taught as a medical student, and when I was training, some physicians might feel different. It's certainly a relationship you have with your patient and your physician, but typically if this was my patient, I wouldn't recommend any surgery if they were not having any symptoms. That's just the way we do those things. Normally gallbladder symptoms are nausea, vomiting, abdominal pain, that sort of thing. Normally worse with eating. So the symptoms normally creep on you. It's not something that's sudden. It can be, but normally not life-threatening. So there's time to watch and observe, because surgery is a risk. Because you might have complications with the surgery. You might have to be in the hospital, miss work, the surgery might go wrong. So you just don't want to go into surgery if you don't need it. And a lot of times that's a relationship you have with the surgeon. The surgeon talks to you about that. So a physician like myself might send the patient to the surgeon, but the surgeon might say, you know what, you don't really need it, you don't have any symptoms, come back when you do have symptoms. So at this point in time, I wouldn't recommend it.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This 54-year-old female says she's had 2 cortisone shots in her back in the last month. How long must she wait until she can have another shot? Obviously in pain.
Yeah, as far as I know, normally you're talking about 2 to 3 weeks in between injections. That's standard. But if one works, then we stop at 1. Normally it's 3 shots in a 12-month period is my understanding. Yes.
So not good. At what point does she need to go to the next level, and perhaps is the next level surgery?
No, I think she can get another injection.
Okay.
And if that fails, then the pain management doctor would typically offer some other modalities if they haven't already offered those. Physical therapy, TENS unit, sometimes a pain pump, an adjustment of some of her medications, and certainly working on the lifestyle and the diet, weight loss, etc. So normally back pain is a multi-modality treatment. It's not just surgery. As we know, normally that can be detrimental because surgery can sometimes make that worse. So normally it's a non-surgical approach for back pain.
Okay. 56-year-old female has shingles and is having a bad outbreak. Is the shingles contagious and can she get vaccinated?
Normally you can get vaccinated probably, but you're covered for about a year or so after a shingles flare. You're not necessarily contagious as long as someone not rubbing their hands and face in the lesion. You don't necessarily have to quarantine yourself. As you know, we become infected with that virus. Most adults, it's a ubiquitous infection at a certain age. That's why we strongly recommend the shingles vaccine starting at the age of 60. So normally once you have a flare, you're protected for about a year or so.
Okay. A 43-year-old male has bruises on the back of his thighs. He doesn't know how they developed. He's worried that they could develop into blood clots. Is this something to be worried about?
There is. Certainly, sometimes you can have a hematological issue that's causing the bruising, and any hematological issue could potentially cause increase of blood clots. So I certainly would be concerned. We can normally diagnose that with some simple blood tests in the office. Might include an x-ray of the thigh. He could be on medications or blood thinners like aspirin, Plavix, Coumadin that could very easily cause bruising in the skin. So I certainly would be concerned.
Okay. A 69-year-old female, can heart failure be reversed?
Typically not, but sometimes yes. We have a lot of medications that are new on the market that in combination can preserve and actually reverse or improve function. A lot of times once a person has the diagnosis of heart failure, they tend to carry that for the rest of their lives. So we can improve the function of the heart as long as they're on the medications and as long as everything else is the same in terms of treating their diabetes, high blood pressure. So there is strong possibility that it can, but you normally continue to have the disease. It's almost like diabetes. Once you have it, but it can be managed very successfully.
Okay, a 70-year-old female, how is mucus in the esophagus treated?
A lot of times it can be extracted through an endoscope, especially if it's a lot, but this doesn't come up that often. Normally the body tends to handle that. Sometimes stroke patients or elderly patients with dementia have problems handling the mucus and secretions and they get choked very easily, but normally the body manages the mucus very well. As far as I know, there's no Mucinex for the esophagus.
Okay. If there is, will you let us know?
I'll let you know.
All right, Dr. Levine, as always, we appreciate your help in stopping by, and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or post those questions every Monday on our KFTM News Facebook page.